What does your day normally consist of?
My day with the cardiac patients would be as I'm pulling their charts out to get them set up for when they come in. We're not computerized yet the way we could be. We're working towards that, so we do a lot of hard copy paperwork. So as I'm pulling charts, I'm looking at what they did the previous workout and thinking, okay, is this person ready to do a little more? Maybe a little longer if they're not up to the full time. Are they ready to increase the speed a little bit or the grade? Are they ready to increase the resistance level? So I'm kind of looking at that. And then when the class is actually here, then I lead the warm-up and cool down stretching. And then we're kind of talking and we have fun too. People get to know each other, and it's nice to see a nice camaraderie develop between patients. So there's some socializing going on as we're stretching, and we encourage that. Then they move to their first piece of equipment, and during the next 40 minutes, then my role is to work from person to person and see how they're doing, if they have any questions or concerns. For example, yesterday, one of our guys on the treadmill has found that going faster than about 2.2 or 2.3 miles an hour causes some soreness in his back. So we decided to actually drop the speed a little bit and work more with the grade now. So, we rely on them to ask questions and tell us also if they've had any issues with their exercise at home, if they've had any falls, any fainting spells, any of those things. We want to be aware of that, and we also communicate with their cardiologists if there's a problem with their heart rates or blood pressures. One of the nurses is usually on the phone right away before they even leave, talking, if possible, with the doctor directly or one of the nurses, and we're trying to make sure that, number one, we're always safe here. We have a great record for safety. It's our primary goal. We do lots of blood pressures. They get a blood pressure before and after exercise and on each piece of equipment. So we do lots of blood pressures, and when we do the weight exercises, I lead those also. And one of my other roles is I have to be able to modify those weight exercises for somebody that has, say, a shoulder problem. Because they're mostly upper body, we deal with a lot of shoulder issues, torn rotator cuff. So there's a way to really modify all of those exercises. So I want to make sure that I'm not aggravating, a torn rotator cuff, that we're actually helping make that area stronger. So that would be a typical class. I also have another job that I do at the hospital, which has become more of my hours now. I do a sports training class at night here for high school competitive swimmers. I do a strength training program, dry land training for high school competitive swimmers through the hospital. So I have about 30 swimmers that come 2 nights a week, and that's become a little larger part of my job. So I used to work with pulmonary patients also, but I've had to kind of pull out of that to accommodate the increased number of swimmers that come to that program.
How are you connected to other fields of movement science?
Well, I already mentioned, the physical therapy. Some of our folks maybe are going to physical therapy or were doing physical therapy before they came to us. So part of what we do is one of the nurses does a very, very thorough assessment, an initial assessment. And it's a lot of medical history. We want to know, if somebody's had knee surgery, what they've had done, when they've had it done, if they've had knee replacement. So from that medical history, then we might, if we feel like, if the nurse feels like that person might benefit from physical therapist, we actually have a physical therapist at Holland Hospital that can actually come here and do some kind of one-on-one teaching with somebody. I actually, even though I'm not a physical therapist, I take that initial assessment and then I look at that and I decide which two pieces of equipment are going to be more appropriate for the person. For example, one of our older ladies, she's I think 83, yesterday came in and she's been having foot trouble. Saw a podiatrist the day before and he recommended not walking for about 2 weeks to let part of her foot heal a little better. So he doesn't want her to do that weight-bearing exercise. So she's already using the new step, so I got her on a recumbent bike, which she actually liked quite a bit. So, you know, take information that we get from other people, like physical therapists or doctors, and take that and then adapt what they're doing here so that we're not aggravating hips and knees and shoulders. We're actually helping make them stronger. Sometimes people, because they maybe were ready to do physical therapy, this is one of our ladies that just started, she was ready to do physical therapy for her shoulder, torn rotator cuff. Well, now that kind of got put on hold because of the heart issue. So she now is ready to start that therapy now that she started cardiac rehab. So I don't have her doing much with that arm until she really gets started with therapy. Then we'll maybe gradually incorporate some of the things that she's doing with therapy. So we do have to be aware of those orthopedic issues.
What is the reward of being a cardiac rehab specialist?
The reward is seeing people improve. That's really what does it for me. I've been an athletic coach, a swim coach in the past, and you know, seeing your swimmers get faster and stronger and progress in their swimming career. I just kind of do the same thing with the cardiac people. It's a totally different population, but it's really, for me, just as enjoyable to see somebody doing better on the treadmill and the other equipment and getting stronger and really adopting a healthier lifestyle. I like that just as much as having a state champion swimmer. It's really fun to see the people that really were not exercisers, and they come in and now it's like, and I've even had people say to me, you know, the only reason I'm here is because the doctor and my wife told me I have to come. I really don't like to exercise. And usually that person will kind of change their attitude, because we're not here to overwork them. We only work at a moderate to moderately hard level. We want to strengthen that heart gradually. They start exercising, they feel better, they're able to do more things on their own, and it's kind of fun to see that person then become actually a lifetime exerciser. So kind of my goal is, and really the goal of all of us, is that we only have patients come through our program one time. Doesn't always happen that way because of family history, but if we only see them one time and then they're on their own and they're watching their diet, they're exercising and taking care of themselves, that's the best that we can ask for.